Molar pregnancy, also known as a Hydatidiform mole, is a form of gestational trophoblastic disease, GTD. GTD includes a variety of conditions arising from abnormal tissue growth in the placenta. Some related conditions include complete and partial moles, placental site trophoblastic tumors, choriocarcinoma, and invasive moles. What makes molar pregnancies unique is that these tumors originate exclusively from gestational tissue, rather than maternal tissue. Hydatidiform moles are categorized into two types, complete and partial. Both types are generally non-invasive forms of GTD, meaning they're considered benign. However, they carry premalignant characteristics, meaning they can sometimes progress to become malignant or invasive. Out of these two types, the complete mole is the most common. Complete moles contain no fetal parts, whereas partial moles might have identifiable fetal tissue. Complete moles are typically diploid, containing 46 chromosomes, while partial moles are triploid, with 69 chromosomes. One main feature of complete moles is that they secrete large amounts of human chorionic gonadotropin, HCG, a hormone associated with pregnancy. In about 90% of complete moles, the karyotype is 46XX, with the remaining 10% being 46XY. Complete moles occur when an egg without genetic material is fertilized by either two sperm or a single sperm that duplicates, meaning only the paternal DNA is expressed. In partial moles, the karyotype is usually triploid, 69XXX or 69XXY, indicating that both maternal and paternal DNA are present. With the advent of ultrasonography, most molar pregnancies are diagnosed in the first trimester, often before noticeable symptoms develop. When symptoms do occur, the most common sign of a complete mole is vaginal bleeding during the first trimester. This bleeding often has a distinctive, prune juice appearance and results from molar tissue separating from the uterine lining. Patients with complete moles may also experience severe nausea and vomiting due to the elevated HCG levels, and some may exhibit symptoms of hyperthyroidism, such as tremors, increased sweating, and diarrhea. Patients with partial moles typically have symptoms resembling those of an incomplete or missed miscarriage, such as vaginal bleeding and an absent fetal heartbeat. Additionally, in complete moles, the uterus is often larger than expected for the gestational age, while in partial moles, the uterus may be smaller than expected. In any pregnant woman presenting with vaginal bleeding, a quantitative HCG blood test should be performed. Complete moles usually have very high serum HCG levels, often exceeding 100,000, while partial moles may have HCG levels that are within the normal range or even lower for the gestational age. For imaging, a pelvic ultrasound is the preferred diagnostic tool when a molar pregnancy is suspected. In complete moles, ultrasound often reveals a heterogeneous mass in the uterine cavity with multiple anechoic spaces, creating a snowstorm appearance. In partial moles, there may be a fetus with amniotic fluid, and the placenta may appear enlarged with cystic spaces. Additional testing is important to assess the patient's overall health and includes a complete blood count to check for anemia, blood type and Rh factor screening, electrolyte levels, and a thyroid panel if hyperthyroidism is suspected. If a molar pregnancy is confirmed, further imaging such as a CT scan or PET scan may be used to evaluate the extent of the disease. In cases of molar pregnancy, stabilizing the patient is the first priority in the emergency setting. Once stable, immediate consultation with an obstetrician is crucial. Treatment typically involves uterine evacuation through dilation and curettage, D&C. In patients over 40 or those who have completed childbearing, a hysterectomy may be recommended instead of D&C. Understanding molar pregnancy and seeking early treatment is essential for both physical and emotional recovery. With advancements in diagnostic techniques, early detection and management can help prevent complications and support the patient's health and future fertility.